October was Breast Cancer Awareness Month, as always, which marks an important time in the calendar each year to discuss breast cancer. However, breast wellness for women without breast cancer is a discussion that should not just be limited to once a year. And to open the discussion today, we are joined by Ms. Morrogh, who is a consultant general surgeon and medical director of the Mater Private Wellness Programme at the Mater Private Hospital here in Cork. A big long spiel there. Some title. You're very welcome to us.
Thank you.
You really are welcome to us.
To be here.
I suppose every woman will worry about the potential of breast cancer at some stage of their life. I think that's quite normal. What are the actual risks?
The risks for breast cancer. So I guess the actual risks for breast cancer are, people need to know that cancer in general is common. And when it comes to us in Ireland, it's estimated that 1 in 3 of us will experience cancer in our lives. And breast cancer is the second most common cancer in women. In Ireland, we diagnose just over 3,000 breast cancers every year. And of those cancers, the vast majority will be diagnosed in people in their postmenopausal years. So that's women over the age of 50.
And are the figures on the increase?
Not really, actually. The figures have been steady over time. There was a time when we introduced the National Breast Screening Programme, which has been a hugely important and massively successful thing in Ireland. And at that stage, our incidence levels, the pickup rates increased because we were looking for those cancers that were silent, that hadn't yet developed into any symptoms. So at that point, the cancer incidence increased. But we haven't seen a general increase in the levels, but what there has been an increase is in awareness, because now everybody knows someone who's had a breast cancer and we talk about it more.
Yeah, that is actually very true, of course, and in families as well. I suppose you have genetic breast cancers. I know in my own family, on both sides, we've had the experience of losing people to breast cancer.
Yeah.
Can I just ask you about that genetic side of things? How much more risky is that if you do have breast cancer in your family?
That's a really good question, because again, it goes back to the whole thing that common things are common, right? And so breast cancer is common. And well, we all have a family, right? So we all have somebody in our family who has had breast cancer. But it's really important that people know that genetic breast cancer is actually really rare. So of all of the cancers that we diagnose every year, maybe 5% of those will have developed because that individual was actually born with a faulty gene that predisposed them to developing a cancer. So we don't want the message out there to think that, oh my God, my sister or my brother, and just because of that this cancer is genetic. It's rather, cancers happen, and cancer is getting more common.
People, though, should people that are, say, more susceptible, more at risk, should they have mammograms more often than other people?
Oh yeah, absolutely. And we've really clear pathways with that. So, if you have a family member who was diagnosed with breast cancer, or a few family members, the important questions are, well, who had cancer? What cancer did they have? How old were they when they developed this cancer? Try and get information. We always tell people that information is power. And then it's a case of going to your doctor, starting with your GP and saying, well, look, this is my family history. Is this important and does this matter for me? And being, when I'm always asked about wellness and what is wellness, and that is actively participating in your health, right? Health promotion and disease prevention. So you get your family history, you talk to your doctor about it. And the GPs are wonderful, and they're very well able to do an initial risk assessment, identify those women whose family history is perhaps a little bit more significant than others, and then they send them to us in the hospital, in the breast clinics. We go through their family history more thoroughly. We select out those families that we think are, for want of a better word, a strong family history. And absolutely, for those families, well then, a heightened screening is really important.
Yeah, I think it's really reassuring for somebody who has breast cancer that there is a path now, and a very, very clear path of what to do next. It's very important to have that, isn't it?
Oh, hugely important. And that's the big thing, what we do have in our system. We have really good pathways. And you'll have a lot of people out there who, I guess we refer to them sometimes as the worried well. They get a breast symptom, or they've met someone with breast cancer and they become worried about it. And I see that as a good thing. That's someone, being conscious about their health and wanting to stay well. So that's
probably part of the wellness thing, because we say wellness. Wellness is a very loaded term, isn't it?
Yeah, very. And I get asked that all the time, like, what is wellness? And I guess I've reflected on that, and I'm trying to decide what is wellness to me as a doctor. And so in my day-to-day practice, wellness for me is, well, how can I empower that person in front of me and educate them and help support them to be actively participating in their health.
And peace of mind as well.
Yeah, hugely. So, you know, health promotion, disease prevention, and personalise that to themselves as individuals.
What about certain medications and breast cancer?
Yeah, we get asked that question all the time, and it's a really important one. So I guess the two main things in medications in breast cancer would be the OCP and HRT, so the contraceptive pill for younger women and HRT for women in the postmenopausal years. And I guess, you know, the main message is the OCP and HRT do not cause breast cancer. But as with any medication, as a doctor, you'll always ask, and you'll always go through this with your patient. For the OCP, there's a slightly higher, maybe a higher risk of developing a breast cancer.
If you're on the pill a long time, is it?
But you have to be on the pill for a long time, and it's the combined pill. So it's what pill are you taking, how long are you taking the pill for, et cetera, et cetera. But it's a risk-benefit thing, right? The benefits
it's a balance,
of it,
I guess.
it's a balance. The benefit of it is nearly always going to outweigh that risk, but it always has to be an informed conversation. And the same thing with HRT. You know, HRT is prescribed by informed and educated doctors to patients who really need it for all the good things that it does, and nothing is without risk, right? So you need to be mindful of what HRT you take, how long you're going to take it for, and whilst you're on the HRT, what are you going to do to maintain your breast health? Keep an eye on your exam, be compliant with your breast screening, all the standard things.
So just within the wellness part and awareness as well, like we always talk about, say, early detection, and that's really the key to the whole thing, isn't it?
Absolutely. So early, well, I guess it's risk reduction and early detection. And risk reduction, and people ask, well, what are the risk factors for breast cancer? And we talk about the things that you can change and you can't change. You can't change the fact that you're a woman. You can't change the fact that you're getting older. You can't change the fact that you might have a family history of it, but you can change how you live. So positive, healthy lifestyle choices are really important.
So no smoking, obviously, is number one.
Smoking, low alcohol, regular exercise, eat well.
The stuff we talk about all the time.
All the time,
but we
right?
don't really do them all the time.
Easier said than done
Easier
sometimes.
said than done.
But, you know, they are important, and we all need to take responsibility for our health. You know, so if you're worried about your cancer risk, not just breast cancer, you make sensible choices, you know.
What about breastfeeding, having a child late in life, women who are childless? Do all these things increase the risk? If you breastfeed, does it decrease the risk? And having a child later, does that increase the risk?
All very small. These are all very small marginal risks, right? But yes, we do know that women who have an early start in their period, so the period before 12, the age of 12, or have an extended estrogen exposure, so menopause late in their 50s, so that's one group of people, yes. Okay. Women who don't have children or perhaps had a child late in their mid to late 40s, yes, we do know those women too. Yeah. So yeah, that's true. But these are the smaller, kind of somewhat negligible
I suppose
risk
the most
factors.
important thing that
and
all of us...
breastfeeding
helps,
massively important.
Every woman should check themselves. Isn't that probably the thing we can do at home without having a mammogram or anything else?
No, just know what your normal is. People will come into us in the clinic going, well, I don't, because I don't know what it's supposed to feel like, and I think I've really lumpy breasts. And we just try and say, look, you know what, it's not about what yours feel like compared to someone else's. You just need to know what's normal for you. Examine yourself once a month. If you think that something has changed, you do something about it.
Brilliant.
Really simple.
Thanks so much for that, outlining a lot, allaying a lot of fears as well of people at home and worried maybe about the wrong things. But obviously take care, as Mary says, be mindful of your health and checking yourself at least once a month. Now, of course, as always, if you have any health concerns, always speak to your local general practitioner. And if you want any more information on today's discussions, you can head onto our Facebook page, of course, which is RTE Today.